Hi, welcome to Seymour's World with Seymour Kazimirski. I have to say that last week's show was probably one of the most interesting shows we have had, and that was on the Black Rice Project. Amazingly, we had hundreds of people asking us, where can we get black rice? And I do have to apologize because I told everybody in error that it was available at Whole Foods. The problem is it is available at Whole Foods, but in extremely limited quantity. So on behalf of Dan Foxman in Chiang Mai in Thailand and myself, I can only tell you that the marketing channels and the distribution channels will be put together, I hope in the next 2 to 3 months, and you'll be able to see it at many, many stores, such as the Vitamin Shop and GNC and Whole Foods and any other organic supplier. So today's show, we are extremely fortunate to have Dr. Eric Ako with us. Eric, welcome to Seymour's World. I have known you for many, many years.
Yes, sir.
You have taken care of all my dogs and cats, or shall I say Sue's dogs and cats? Because family dogs and cats. I think it's close to 20 years probably.
Yes, sir.
Or 25 years. And I just have such wonderful memories of the times that I walk into your practice, and you're always there with a smile. Your wife Lori is always there with a smile. Your staff is so good. I could never get that feeling in my office. In my office, everybody's complaining about something. In your office, everybody's so happy about the job that they're doing. So you're obviously a very good boss.
Well, thank you, sir. My pleasure to serve you all these years. No, we're not perfect. We have our moments as well, but we do. You asked me one of your prep questions on what is a memory of something great that happened. I tell you, it's every day. It's great when I can develop a closeness, a relationship, and work well with others. That's what I'm here for. I'm a veterinarian, but I'm here to help others.
Well, it's obvious because we see it in your practice all the time. Let's talk a little bit about your history. You've been you were born in Hawaii.
Yep.
Born and raised.
Local boy, born and raised. I'm fifth generation. Since you asked, I do have an interesting story. My real name is not Ako.
Oh.
I have the common, made-up Hawaiian name. I'm actually a Ching.
You're kidding.
Yeah.
How did you get to Ako?
My great-great-grandfather came very early during the days of the Kingdom of Hawaii in 1837 from China. And in those days, it was appropriate to have the wife in China, to whom he sent funds, of course. And he also had a wife here in Hawaii, because during the days of the kingdom, in order to have land, you had to have a Hawaiian.
Oh my gosh.
So needed land to grow the rice, of course. And then the Hawaiian people in general were suffering greatly from Western diseases. So you needed an extra Chinese wife to give you even more children. So it's a big family. We're actually Chings. Ako is actually a Hawaiian bastardization of the Cantonese word Ako, with A-G-O, which means big brother.
Wow.
So.
I had no idea that you were actually a Ching, because I know a lot of Chings. We'll have to find out whether they're relatives or not. So let's talk about the pet doctor. You started in 1982?
Yeah, so actually the pet doctor is my second practice. I graduated from Purdue in 82. I'm humbled to say that I was the first local boy that made the grade.
Wow.
And again, I guess I did okay because they did take more students from Hawaii after me. But had to come home in 82. My gills were getting dry. Had to go surfing. Started practice in Kaimuki. By 83, I was in Kahala and owned my first practice in Kahala from 87 till about 90. That was a relatively large 5-veterinarian practice. And suffice to say, I'm now on my second practice, just by my lonesome, but I'm enjoying it. I have really no plans to retire, just enjoying what I'm doing.
I find, Eric, that you don't give yourself enough credit. You were the past president of the Hawaii Vet Association.
Yes, sir.
You're currently on the board. You were the past president of the Honolulu Zoological Society. You're a board member of the Hawaiian Humane Society, and so on and so on. But you have something that I bet no other veterinarian has here, and that is an association with the Hawaii Historic Arms Association.
Yeah.
Am I correct? Are there any other vets in that?
Actually, not that I can think of. Man's got to have a little bit of fun.
So what is the Hawaii Historic Arms Association?
Okay, I've always had a strong interest in history. So I'm an avid reader. I probably read at least one book a week, largely history books. So in honor, in reverence to those before us who have sacrificed their lives, literally, during World War II, for example, I have become somewhat of an expert. I actually own military vehicles from World War II. I've collected uniforms and weapons and accoutrements from the period. We volunteer at public events such as Living History Day at the Waikiki Army Museum or the Schofield Barracks Museum. We've been at the Arizona Memorial on the morning of December 7th to honor our veterans. Mm-hmm. So Hawaii Historic Arms, basically a group of ladies and gentlemen who have appropriate reverence for history and the sacrifices that were made for our country.
I think it's wonderful you do it. I was also privileged to speak at one of your groups.
Yes.
And we talked about the Holocaust and my mother's experiences, and I was amazed at how many people came up to me afterwards to discuss their personal stories about the Holocaust, because a lot of them are vets from the Second World War.
Yep.
So they served in Europe, they served in different parts of the country. So that is a great part of Eric Ako that I bet you very, very few people know, and that is your association with history. I think it's wonderful. Let's talk about veterinary medicine. We have so much to cover. I guess the first thing we have to ask ourselves is, how has it changed? 1982, we are now 2014. What is the major change in veterinary medicine?
Well, I hope that we've gotten better at it, serving our community better. As the executive officer for Hawaii Veterinary Medical Association, we're dedicated to the delivery of quality services to the community. And we have many concerns that are ongoing, but certainly the technology has improved. The availability of modern pharmaceuticals has improved. I hope that we are constantly improving our communication skills, which is always a key to the effective delivery of services. For example, our communities have certainly grown. Thinking about the east side, there are now 4 veterinary practices in the Hawaii Kai area. When I first started, there was 1. In the Kahala area, there are now 3 practices. When I moved to Kahala in '83, there was 1. So just a sign of the times. In contrast to the rest of the nation, in general, we've not suffered from the recessions that have occurred. We've remained fairly steady, if not grown. Right this moment, we have practices that are growing. We have new practices. There's a new practice in Kapolei right now.
Eric, in terms of difference of service from 1982 to 2014, has technology, is it still the same technology from '82, or has it grown dramatically as it has in human medicine?
Yeah, oh no, good news. Kind of exciting times to be working. For example, in the past, we were lucky to have visiting specialists who would come and visit Honolulu from the mainland, stay for maybe a week, and then go back. Come back to the islands maybe, if we're lucky, 3 to 4 times a year. And then we had a smattering of specialists. We had a veterinary ophthalmologist and a surgeon or 2 who were resident. But now we are having practices which have multiple specialists, full-time, resident, 24/7, 365 days of the year. I'm so very pleased to see our profession growing in that fashion. More services are available. For example, not just x-rays, CT, MRI is now readily available when appropriate.
We're going to talk about insurance. We're going to talk about cost.
Yep.
We're going to talk about the pharmaceutical delivery to the animal. And we're going to talk about microchipping, which is obviously one of my favorite topics. And in full disclosure to everybody, I have to tell you that Eric Ako was a champion for me. When we started the microchipping business, we were looking at how do we get the veterinarians to understand that this is necessary rather than to have a dog tag or something on your collar. And Eric understood immediately. At the time, you were the president of the Hawaii Vet Association, and he invited me to come and make a presentation to the vets. And it took a while. It took us a year or two, and then all of a sudden everybody caught on. And I really thank you for that, because microchipping of animals, as far as I'm concerned, saves lives.
Absolutely.
How is it for you from your involvement?
Statistics have proven that to be true. It's the installation, a relatively simple process. I've done thousands. I've not had any adverse reactions. The worst case scenario is the chip might move from the shoulder to the side, but it's not harmful, so no side effects of any significance. And studies have already proven that Honolulu enjoys one of the highest return to owner rates anywhere in the nation.
That's correct.
Largely due to the microchipping and identification, the possibility of identifying the pets without a tag, without a collar, but the microchip's there with a little handheld scanner. So it's terrific to be able to, it's a horrible feeling when you lose your pet and you have no idea where it is. There's no closure of any kind. And I myself experienced that. And I said a prayer to that guy up there and said, I'll do anything if you just get him back for me.
And was he found because of the microchip?
Yeah.
Yeah, that's
Thank
great.
you.
Yep. And thank both of us.
Yes.
Obviously, were very involved in that. It was quite a road those first couple of years,
Yes.
because microchipping was, a lot of people didn't like the idea of putting something into the animal via a syringe.
Yes.
They could understand if it was a typical veterinary item that goes in. It could be blood, plasma, whatever. But when it comes to a piece of something that's coated in, foreign item that's coated in pyrroline, and it's got to be put in with a syringe that's the size of a grain of rice. But man, has it ever worked? There's over 14 million animals today microchipped. And we started it here. You and I started this whole thing. It was quite something. I think it was great for the community. And it's always nice to hear that Hawaii is on top. It has, as you said, the largest number of animal retrievals by microchip than anywhere in the United States. It's also one of the few states that has mandatory chipping for all adoptive animals.
Right.
So if you go to the Hawaii Humane Society and you adopt an animal, it is going to be microchipped. It just has to be. That's the way it is.
Right.
Eric, we're going to take a short break.
Okay.
And then we're going to come back. This is Seymour's World with Dr. Eric Ako. Thank you.
Hi, my name is Dr. Rafi. Every week, I'm right here at ThinkTech Hawaii, 3 p.m. on Mondays. My show is Boards' Bio Briefings. What do we do here? Well, we watch sperm swim. We see if they catch anybody. We check out the latest biosimilars. The kind that, what was his name, the guy with the bicycle? I guess we forgot his name, but he was taking EPO and other human growth factors. We'll be talking about human growth factors. You want to know where to get some? Maybe I'll tell. Anyway, you can catch me, as I said, every week right here, Monday, 3 p.m., ThinkTech Hawaii, Dr. Rafi. You can also find me on Twitter, BioInfoMedical. Or you can catch me on Facebook, Dr. Rafael Boritzer. I'll be happy to converse with you. Aloha.
Welcome back to Seymour's World. I'm Seymour Kazimirski. We're very pleased to have Dr. Eric Ako from the Pet Doctor, who, in all full disclosure, is my veterinary doc for our dogs and cats. He's been a family friend for a long, long time, and he helped us develop the microchip business here in Hawaii. So now we're going to talk, Eric, about the delivery of medicine, food, etc. to the animals. Let's talk food.
Okay.
1982, 2014, what should people be feeding their animals? What is the common cause of the wrong food to be given to animals?
Well, taking us back to small kid days, as we say, you know, most people fed literally the table scraps, not the table food, the table scraps. And if you went shopping, you only had maybe a handful of different products to choose from. Purina, Skippy dog food, Gravy Train comes to my mind. Nowadays, there's literally hundreds of different SKUs of food, different types. And as a professional, as a scientist, we're increasingly challenged with making sure that owners choose properly. The basic rule of thumb is it has to have the AAFCO, AAFCO, seal of approval. And then you should ask your veterinarian, because there's all kinds of stuff up there. Generally, they're all high quality. In fact, most pets, I'd have to say, are overweight. One of the things about living in Hawaii is, remember that all of these pet food labels are developed in temperate climates on the mainland. So in the tropics, pets eat less. So whatever the label says, don't do it. It's less.
Okay.
Maybe even half as much. Another challenge we have in the pet food industry is home cooking. Unfortunately, it has good intentions, it's a good idea, but statistics have shown that majority of home cooked diets end up being not balanced. What we encourage people to do is to follow a bona fide recipe, and you can't be skipping on ingredients, because then the diet becomes unbalanced.
What about, Eric, one of the topics that I hear a lot about, should an animal be fed twice a day, 3 times a day, once a day? I mean, in the old days, it was always once a day, but lately...
Here's where you should think natural. Carnivores, cats and dogs, hunt in the morning and in the evening. So it seems most logical to give 2 small meals. And that's the most compatible.
Okay, good.
Furthermore,
Yeah.
if your dog or a cat is perfectly well, but occasionally doesn't finish a meal, don't worry about it. Don't get the gravy out. Don't do that.
We talk about food because it's obviously one of the things that we do with the animal every single day, right? Sometimes twice a day. Let's talk about food that comes from sources that are not, is it AAFCO approved? Could you repeat that again?
Right, yeah.
AV?
AAFCO.
AAFCO. What about food from China? What about food that's coming in that is not, that's bargain basement type food?
Right.
I'm always worried about that.
Okay, so keeping an open mind, when clients tell me about foods that I think are questionable, I offhand don't slight them and say negative things. In fact, I'll say, well, if your pet is doing okay, and I can see them, they're in front of me, I'm examining them, then okay, but just keep in mind, if you start having a problem, you let me know, we'll address it. Foods from China. I hope everyone has heard about the melamine problem we had about 7 years ago, where hundreds of dogs actually passed away from contaminated treats. Recently, there's been criticism of other treats from China, chicken jerky, duck jerky, etc., etc. There are 2 American companies that are trying to correct the issue. One is not selling Chinese food at all. They're sourcing out of the United States. The other big manufacturer is trying to get more consistency by buying from a single Chinese producer. This information just came out last week. So, as of right now, it's a sad story that we must say that you should be careful about treats made in China. The FDA has received well over 3,000 complaints. There have been well over 300 deaths, so use caution.
So even are the treats also regulated by this group, or is it strictly pet food that's regulated by the group that has to have the seal of approval?
Right. So that's the biggest weakness with the treats. They're not
they're
regulated,
not
and they
regulated.
do not bear the seal of approval.
What about, Dr. Arco, the issue we have with vitamins, minerals, all the different things you see on the store shelves? And I'm not talking about your practice because I don't see them there. But when you go to a big merchandise type pet store, they have all these extra things for weight loss, and those are not regulated, are they? Similar to human medicine?
Correct. The way these things are regulated is only if enough complaints are filed, then the FDA will check on them after the fact, which unfortunately doesn't help your particular pet because it's too late. So one should be, the intelligent consumer needs to be aware that while veterinarians in general have had fairly open minds, we're willing to listen, we're willing to try, you need to know that some of these things have interactions. So even in the use of alternative herbs for therapy of various conditions, you need to tell your veterinarian what you're doing, how much you're giving, because there can be harmful interactions with other herbs or other Western pharmaceuticals.
Which brings up pharmaceuticals. Let's talk about that. The pharmaceuticals that you prescribe, let's say you prescribe something to a dog or a cat, and the individual owner wants to try to get a cheaper brand, and they go online. Are those regulated, or is there no regulation for that?
Right. Certainly a challenge. On the one hand, as a profession, I think more so than some of our other professions, we've always been concerned about cost to our clients. I know I think about it on just about every patient that I see. I don't want them to be ripped off. I don't want them to spend too much. I want to fix the problem, and therein lies the challenge, fixing it without costing too much. So, on the subject of pharmaceuticals, it's a challenge because we care. We want our patients to be getting what we think they're getting. And unfortunately, increasing numbers of clients are going to the internet or big box stores. Excuse me. And there are a number of concerns. One of them is the pharmaceutical manufacturers are telling us that they're in fact not selling to these outfits. So then the question becomes, well, where are they getting it from? And is it even real? Or is it counterfeit? And unfortunately, there have been cases proven, excuse me, of counterfeiting in Hawaii.
Really? And that is also very typical in human medicine as well. We find that when we do some research and we find where the pharmacist is getting some of his product, if it's generic, that term generic is a very, very difficult issue for us to follow as a consumer, because we don't know what the generic drug really is. And my perfect example is I go in and I want to get some ibuprofen, and I see the ibuprofen on the shelf. That's a brand that I know. Then I see the generic brand from the pharmacy. And here in Hawaii, we have Longs and CVS's and all that stuff, and they all have their generic brands. Is that the same thing in veterinary medicine, that you don't know what you're getting in the generic brand?
Yeah, we face the same challenge. Consumers need to understand that generics, and I hear this from nurse and physician friends, generics are not tested. They do not undergo the rigorous testing that the brand products do. There's much less safety and what we call efficacy studies. That is, does it really work? Of course, of greatest concern is the safety studies. So the general policy in the United States, although we do enjoy some of the most rigorous testing in the world, they don't test generics until after there's a complaint. And there again, the issue that I mentioned before, it's too late for yours.
Of course. That's a very interesting perspective on it, because that's followed human medicine, that as the generic drugs have come into the marketplace, we as consumers try to get the best price possible. Therefore, we go and try to find it, a little bit cheaper somewhere. And we've had instances that I know of personally where products are coming in with the same name even that are made in China, but of course have not been tested. And I don't know whatever happened with the product itself, but you know that if you're going to buy something, buy it from a veterinarian, buy it from a qualified source to make sure that it really is what it's supposed to be. You agree?
Yes.
Yeah, I think so too.
One other issue that we should touch upon is recent success. The Board of Veterinary Examiners worked with the Board of Pharmacy to recently publish a 16-point list on the Board of Pharmacy website, where across the nation we've had a problem. Consumers need to know that most practicing pharmacists have no training in veterinary medicine at all. Commonly used drugs in veterinary medicine do not necessarily have the same dosages or effects as on animals. So I'm happy to report that this 16-point list has been published and is available for pharmacists to take a look at. I hope they all do, so that we can avoid any of the problems that have been documented. State of Oregon did a survey. Over 30% of veterinary prescriptions filled outside of the veterinary practice had errors.
Oh.
And 15 plus cases proven of resulting in death of the patient. Not good.
No, not good at all. And that gives you, again, we need more and more regulation to make sure that it's, I mean, we're talking about lives here.
Yeah.
Pet lives to
We
most
think
people
of them
are,
as our family now.
they're part of the family. So
Yeah.
definitely everybody wants to make sure that it's correct. Well, before we go to the next break, which is going to be what everybody, I did a survey, by the way, of what people wanted to talk about. And of course, one of them was the high cost of veterinary medicine. So we're going to talk about that in the next part. But I did want to discuss with you one issue that I thought is very important, and that is the new areas of 24-hour emergency care here in Hawaii. And we do have that. And I don't know how many of you know that there are 24-hour services now. I know the one we used was on Kapilani Boulevard. Are there any others besides that?
Yes. There's a corporate practice out in the west side that has actually been around even longer than the Kapilani one. But exciting times for veterinary medicine. We're definitely growing. We're not only offering 24-hour service, but we have more specialists. So earlier, I think I talked about the specialists. Well, one of these places actually has a board-certified veterinarian in emergency and critical care. And these services are available 24/7.
Which is
There's
wonderful.
a nice team going on over there.
So at nighttime at 2 a.m., you don't have to wait for your vet practice to open up. You can go directly there. Do they have access to all of the records of the pet? Wonderful. So you guys are all integrated when it comes to that? Wonderful.
Yeah.
Excellent. It's similar to an emergency room in a hospital then that's open 24 hours a day.
Maybe better.
Could be better. I don't know. We are going to take a short break. We're going to be back with Dr. Erica Ko talking about the cost of veterinary medicine, insurance for your pets, and some of the other great topics that we have for you. This is Seymour Kazimirski on Seymour's World. Thank you.
Aloha, I'm Jay Fidel. This is ThinkTech Hawaii, broadcasting live from the Pioneer Plaza in downtown Honolulu. We raise public awareness about tech, energy, and globalism in Hawaii. Technology is critical to our state. A vibrant tech sector will give us new prospects in the global marketplace and will offer great careers and make our economy more resilient. Streaming live on Ustream and Spreaker, ThinkTech allows its hosts and guests invaluable opportunities to report important events and discuss important questions, and to be heard here in Hawaii and around the world. You can find links to our live streams on thinktechhawaii.com or on our mobile website, m.thinktechhawaii.com. And you can see our archive on YouTube. It's all just a click away. We want to do whatever we can to keep Hawaii relevant, connected, and thriving in the complexity of the 21st century. We hope you will help us in those efforts. Tune in today. This is ThinkTech. I'm Jay Fidel. Mahalo.
Hi, welcome back to Seymour's World. I'm Seymour Kazimirski with Dr. Eric Ako of the Pet Doctor Clinic in Kahala. We have had a wonderful time talking about all sorts of things, but now we have to talk about something that is on the mind of many people, and number one on the survey that I did before we came for this broadcast, and that is the high cost of medicine. And how do we help people understand why it's gone up that high and what to do about it. So I'm going to open it to you, and then I'll ask you questions. Go ahead.
Okay, well, the good news is, I think, in general, as a profession, veterinarians have always been concerned about the costs. We know that you bear the costs directly. Not enough of you have insurance, which is a good idea. And so we're constantly thinking about ways for more effective delivery of services. So the reason costs are rising is because we're, like human medicine, we're constantly having new products, new pharmaceuticals, new drugs to use. And unfortunately, the cost rises. We have more and more services available. As I might have mentioned a moment ago, specialty practices can offer not only radiographs, also commonly known as x-rays, but ultrasound or sonograms, computerized tomography, commonly known as CT, and even multi-resonance images, MRI, is now available in veterinary medicine. And yes, for the very first time, we're having resident specialists. In the past, we're just general practitioner veterinarians with occasional visits by specialists. So all of these things, but particularly the increasing demand for services as people's perception changes and they want more for their pets, this is what is driving costs up.
Do you think that animal owners should, or are they coming in? I hear from regular physicians in human medicine that the emergency rooms have a 30 to 40% factor of people coming in for nothing more than a common cold. You know, they're experiencing a little chest pain and all that stuff, and it's basically just a cold. Do you have the same thing? Are a lot of people coming in with their pets for what they think are poorly diagnosed items on in their own minds? Should they be just coming in for checkups or wait a little longer to come and see you?
I encourage communication. Communication is always the key. So whenever my clients have any question, I prefer that they at least call. And if they come in and it turns out to be nothing exciting, I'd like to think that my 30 years experience gives me the confidence to tell them so. Mm-hmm. And not encourage them to do unnecessary, perhaps, diagnostics. With the caveat that, well, I might be wrong. You might find something if you do all of that. But there again, that's why it's so important for a veterinarian to develop a close relationship with their clients so that they can help the client make that kind of decision.
We talked about insurance as an important item for parents of pets. I'm going to call them parents of pets to start looking at. Actually, as we discussed, I tried with a partner, with Baron Gus, we tried to open up an insurance company called Hawaii Pet Care Alliance, HPCA. This is 15, 20 years ago. And it didn't work. Why didn't it work, and why is it working today?
Changing perceptions of the customers. For example, 10 years ago, I would never have believed that people would actually brush their dog's teeth. And yet I can tell you today with a straight face that I think probably 75% of my clients actually do use a dentifrice daily.
Wow, that's amazing.
At least I hope it's that high.
That is amazing. They really brush their
So,
teeth.
you guys came in at a time where I think the people were just not ready. And the fact is that at the time, there were many other efforts to establish pet insurance companies and had failed. Well, shortly after your effort, we have the very first company that has persisted and has been successful, and that's called Veterinary Pet Insurance.
Yeah, VPI.
Yeah.
Right.
Now there are a couple of others that are equally successful. So we would encourage, it's certainly one way of keeping your costs down, especially for the big things.
Such as cancer treatments, broken legs, things like that.
Right.
So are you recommending when a patient walks in, have you thought about insurance? Is that something that you do?
Yes,
Good.
and we hand them a brochure.
Good.
It's routinely included in our puppy pack.
Good, good,
So,
good.
yeah.
Yeah, I think it's, for our audience, If you have a pet, you know how expensive it is. I personally feel, and I've said this to Sue, I feel your costs are very reasonable. When I see the bills coming through, they're very reasonable. But anytime something serious happens and we have to go to a specialist for it, we've been to an ophthalmologist for care for one of our dogs. We've been to the Capulani service, the 24-hour service. Those are expensive. So if you feel that you want to get covered, I think insurance is a great idea. Great idea. Do you recommend any different plan, or do you think they're all about the same?
I think if you definitely should sign out for a catastrophic type plan, because people are opting for those newer types of services such as cancer therapy, whereas in the old days it was not so much. More and more people are going for cancer therapy, and in fact it's increasingly successful in prolonging a pet's life. But it's very expensive. The drugs are all the same as human beings.
So it's chemotherapy, that kind of stuff? Really?
Yeah.
Wow. And people have to pay for it out of their pocket if they don't have it covered by the insurance.
Yeah.
Do you see insurance becoming more and more prevalent in your practice? People, do you have to make the claim for the insurance, or does the
We
pet
assist
owner?
the client by filling out the appropriate paperwork.
Okay, excellent, excellent. So from 1982 to 2014, here we are. We know the costs have gone up and everything, so we don't anticipate that they shouldn't go up, obviously. And I think our audience has to know that we realize that costs are going to be higher than they were then. Is there anything that you feel that people do that they shouldn't be doing to their pets that would help in reducing the cost?
Too many treats.
Too many treats. I look at myself and I say, I take too many treats.
Well,
So-
I'm equally guilty too. So, but yeah, most of our pets are a little heavier than they should be. And really it's, wear and tear on the body. Large breed dogs, you got to watch out for the arthritis. Long, short dogs, you got to watch their backs, their spine, intervertebral disc disease.
So food, obviously restricting the food and the treats. What about exercise?
Absolutely.
More the
but
better?
it's more the food than the exercise.
Uh-huh. Okay.
As I've learned from myself.
Yeah, and I'm there with you. When it comes to animal care itself, do you find that it's from 10, 15, 20 years ago, are people caring more for their pets? Are they paying more attention to their pets?
Oh, definitely, yeah. Pets are serving us in many ways. We see it superficially as that we treat them as family, but yeah, they serve many needs.
I can tell you personal experience. We have a program called Make 'Em Smile, which has been on Seymour's World, where we bring musicians to the hospitals. And one of the wonderful things we have is we have a dog. They're called Tucker. Tucker is at Capulani Children's Hospital, and that dog comes around with our musicians. And what a team that is, the musicians and the dog, to make a child feel wonderful, to make them feel good. No matter what they're feeling in their body, all of a sudden they see the dog and they see the musicians, and the two of them make a great tag team. So yeah, dogs have become truly a wonderful piece of psychological help for patients.
Mostly dogs, but also other species. We call it pet-assisted therapy. And not only for the sick or for the children, but also for the older. A lot of the seniors become reclusive, but when a dog walks in the door, whoop, all of a sudden,
Wow, that's wonderful.
new situation.
That is wonderful. Now, does your practice involve other animals besides? We've only talked about dogs and cats. What about the birds?
Actually, I'm most well known with my colleagues for taking care of birds.
Oh.
So I saw this need when I was a pre-vet student and took it upon myself to take a lot of extra classes and whatnot. And got a special gift from the Lord above to do what I do.
That's wonderful. Wonderful. We're going to take a short break and come back. In our last segment, we're going to talk about what's going on in Hawaii, what's happening at the legislative level, what can Eric do or what has been done to make sure that the staff at the clinics are well taken care of. Are there any regulations that need to be imposed or passed to make sure that veterinary medicine continues doing a good job for our pets? We'll be back in a minute. I'm Seymour Kazimirski on Seymour's World.
I'm Hong Jiang, host for Asia in Review on Tuesdays.
And I'm David Day, host for Asian Review on Thursdays. Both of us broadcast our respective shows at 4 p.m.
And my topics tend to deal with questions related to environment, culture, history, and sometimes human rights.
And my shows tend to be on international business, foreign policy, geopolitics, and national security. And you can watch our shows live on the ThinkTech website at thinktechhawaii.com.
And you can also watch us on YouTube or Olalo.
So come join us on Thursdays at 4 p.m. I'm David Day.
And on Tuesdays at 4 p.m., I'm Hong Jiang.
Aloha.
Aloha.
Welcome back to Seymour's World. I'm Seymour Kazimirski. We are very pleased to have Dr. Eric Ako of the Pet Doctor. For the last 30 minutes, we've been talking about your pets, the dogs, the cats, the birds, how to take care of them, feed them a little bit less, which I seem to think is, I should take that same advice. But more important than that is to make sure that new veterinarians who come into the practice, and you may be one watching this show and thinking, do I want to be a vet? We're going to talk about the legislative issues. So let's talk a little bit about what's happening on that side, because I know you're very involved in that.
Well, thank the Lord, we've been very lucky legislatively. We've had 3 initiatives of late. First of all, we got a law passed that adopted the ethics and policies of the American Veterinary Medical Association into law. For example, the AVMA policies say that veterinarians should comply without hesitation if a client requests a written prescription for any drug, without any fee, and without any hesitation.
That's
so
good.
yeah, we all do that. You want a prescription, and I give it to you. The second thing that we were very blessed to have is we have adopted, and it's actually coming active this year, veterinarians are now required to have 20 hours of continuing education for renewing their license.
Good.
So that'll keep our veterinarians on their toes. As quickly as medicine changes, as new challenges raise their head, such as bioterrorism, veterinarians will be there to serve in that respect. This year, I'm working very hard for our veterinary medical team, our veterinary technicians. Veterinary technicians are like our nurses. They can do just about everything. They can do the technical things such as placing IV catheters, administering anesthesia, making prescriptions, giving injections that we, of course, we calculate the dosage. Anyway, they're our nurses, but they can also be practice managers. So they're certainly an integral part of the veterinary team. Right now, our state rules and statutes recognize them nowhere. They're not official, not recognized. We feel that it's high time that we do so. We're actually we are the last state in the union to not do so in any form whatsoever. So we're working really hard. Right now, actually just this morning, we had a Senate hearing for our House and Senate concurrent resolutions calling for what is called the Sunrise Review, so that next year in 2015, we'll actually reintroduce the bills to get veterinary technicians registered in the state.
Excellent. And I'm assuming every practice, how many practices are there?
In Hawaii in general, a recent survey was done with 80% compliance by the Hawaii Veterinary Technician Association. We have well over 200 practices.
So lots of nurses or assistants, whatever.
Yes, we have 700 plus staff. Of that, we already have 53 veterinary technicians who are registered, certified, or licensed in other states, but not recognized right here where they're working. As I said, we have 700 or so other staff members working throughout the state. And not just in private practice, by the way. We have veterinary technicians who work for the state, such as in our animal quarantine system, or our state laboratories. And these people all need to have, to be recognized and to be paid accordingly.
You're right. Eric, the third question that came up in our survey before we came on to the show was how often should we bring our pets for a health examination?
Okay. Well, let's start when they're puppies and kittens. Generally 3 visits, 2 months, 3 months, 4 months. And then after that, every 6 months is a good idea. In the past, we were accustomed to seeing cats every 6 months. But like small dogs, we have to remember that 1 human year is 7 for
Pet
them.
years, yeah.
So if we see them every 6 months, we're actually seeing them only once every 3 years. Aging is faster for the larger breed dogs. First year is generally equal to 7. And then, first 2 years are equal to 24, and then it's 7 for each year after that. So again, the answer to your question is twice a year is a good idea.
And just come in for a health exam. And
Yeah.
some of the insurance companies we talked about do cover that. They'll cover 1 or 2 health exams a year too.
Another basic is we like to do a heartworm test. You know, we're a tropical climate, so we have heartworms. Heartworm test once a year is a real basic. When your pet is older, so for a small dog, that's 10 years. Also for a cat, 10 years. For a large breed dog, it might be 4 or even 7 years. That's when they become seniors. So you might want to have more visits when they're seniors because, as we all know, things start happening.
Arthritises and all that kind of stuff. And there are medicines for that today. I know my
Absolutely.
wife Sue is giving our dog glucosamine right now.
Yes, sir.
And that is a good product. You recommend that?
Yeah, the standard management of osteoarthritis in dogs these days is glucosamines daily and a non-steroidal anti-inflammatory as needed. And there are alternatives. Massage, acupuncture.
Okay, let's talk about it. I didn't know whether we would get to it, but alternative medicine. Should we be massaging our dogs? Should we be doing acupuncture for our dogs? I mean, are we going overboard with this? Tell me your thoughts on alternative medicine.
Well, since the theme of your show is open minds facilitating conversation,
yes.
I'm proud to say that veterinarians are generally much more open-minded about this issue. And most of us are certainly willing to listen, and many of us are willing to try. Pardon me. So, yes, we are on the cusp, so to speak. The latest is laser therapy, not surgical laser. Laser therapy stimulates the cells, generally a handheld device, and nurses the cells back to health.
This is on the surface or on the surface?
Non-invasive.
Right. Okay.
No sedation, nothing.
So similar to me getting rid of my wrinkles and that kind of stuff, we could do the same thing for my dog and my cat. Okay, I'm not sure if I'll pay for that, Eric, but at least I know it's there, right? What other types of alternative medicines are there? You mentioned acupuncture.
So we commonly use various herbs. For example, when I have a patient who has liver disease, I routinely use milk thistle. So turns out milk thistle is something called silibin. And this product, silibin, what it does is it actually helps the liver cells individually heal. So another would be, there's many. We have products that stimulate the immune system that we use fairly routinely in veterinary medicine.
Do you recommend that people come and ask you about alternative medicine, or do you automatically suggest it when a need is there?
Always good to take a look-see, and of course we want the opportunity to offer services such as radiographs or even ultrasound. But certainly communication is always the key. Talk to your vet. You should feel comfortable with your vet that you can call them and you'll get a phone call in return. I think that's like automatic.
I know we do with you, so
Yes, sir.
That's wonderful.
Talk to your vet. Talk about it.
Well, Eric, unfortunately, we have to end the show. There's so much more we wanted to talk about. Maybe we'll get together again if we can, but I just want to say thank you to all of you for watching. It has been a great show. Pets have become part of our family. We talked about that, and I think it's something that we have to realize we're going to be paying more for it, as we discussed, and insurance is a very important part of your plan. If you are thinking of getting a pet, or if you have a pet, you should think about getting insurance. So I bid you farewell. This is Seymour Kazimirski at Seymour's World. We'll see you next Tuesday. Aloha.